friends, today we are going to learn about extraoral examination in fabrication of complete denture. During fabrication of a complete denture, the patient's head and neck region should be examined for any pathological condition. Facial color, tone, hair color and texture, symmetry and neuromuscular activity are also noted. It will include examination of face, muscle tone, lip and temporomandibular joint. First of all, we'll study about facial examination. Facial examination will include the evaluation of facial features, facial form, facial profile and lower facial height. Let's begin with facial features. The following features on the face should be noted during diagnosis of a patient. First of all, perioral features. These are length of the lips, support of the lips, fullness of lips, philtrum, nasolabial fold, mentolabial sulcus, size of the oral opening and the texture of the skin. The size of the oral opening also influences the degree of tooth display. For texture of the skin, if the skin is rough or smooth, light color, so according to the skin we have to place the teeth. For example, if it is a rough texture skin, we have to place rugged teeth. If wrinkles are present in the cheek, this shows decrease in the vertical dimension. So all these factors aid in to determine the shade, shape and arrangement of the teeth. Coming to the facial features, the first form is facial form. House and Loop, Frush and Fisher and Williams classified facial form based on the outline of the face. As you can see in the picture also, this is square, tapered face form, wider at head portion and towards the chin it is narrowed down. Square tapered form, wider in somewhere in the middle and narrower at the head region or towards the chin region. Oval, it is somewhere oval or roundish in shape. Coming to the facial profile, examination of facial profile is very important because it determines the jaw relation and occlusion. Angle classified facial profile as class 1, which is normal or straight. As you can see in the picture, the nose and the chin is in straight line. Class 2, retrognathic profile. In this, the chin or mandible is backwards. It is not in normal relation to the nose. Class 3, prognathic profile. In this, the mandible or chin is in forward relation to the upper jaw. Lower facial height. Determining the lower facial height is important to determine the vertical jaw relation. For those patients who are already wearing a complete denture, the lower facial height is examined under occlusion. If the face appears collapsed, it indicates the loss of vertical dimension. Coming to the classification, the class 1 is normal, which is normal vertical dimension. There is no loss of vertical dimension or there is no increased vertical dimension. Class 2, decreased vertical dimension. Decreased vertical dimension produces wrinkles around the mouth. Class 3, increased, that is increased vertical dimension. Excessive vertical dimension will cause the facial tissue to appear stretched. Muscle tone. Muscle tone can affect the stability of a denture. House classified muscle tone as class 1, class 2 and class 3. In class 1, normal tension, tone and placement of muscles of mastication and facial expression is present. There is no degeneration, common in immediate denture patients. Class 2, slightly decreased muscle tone is there and normal muscle functions present. Class 3, in class 3 there is decreased muscle tone and function, decreased vertical dimension, wrinkles are present in the cheek and drooping of the commissures. Muscle development. Talking about muscle development, people with excessive muscle development have more biting force. House classified muscle development as class 1 heavy, class 2 medium and class 3 light. Complexion. The color of eye, hair and skin guide the selection of artificial teeth. Now, let's talk about lip examination. Lip examination includes lip support, lip mobility, thickness of lips, length of the lips, health of the lips. So, first of all, we'll read about lip support. Lip support, based on the amount of the lip support, lips can be classified as adequately supported or unsupported. Lip mobility. Based on the mobility, lips are classified as normal, that is class 1, reduced mobility, class 2, and paralyzed, class 3. Thickness of lips. Thick lips need lesser support from the artificial teeth and the labial flange. Thus, the operator is free to place the teeth to his wishes. On the other hand, thin lips rely on the appropriate labiolingual position of the teeth for their fullness and support. Length of the lips. It is an important determinant in anterior teeth selection. Short lips will tend to reveal more of the tooth structure and also the denture base. Based on the length, lips are classified as long, normal, or medium and short. Health of the lips. The lips are examined for fissures, cracks, or ulcers at the corner of the mouth. If they are present, these indicates vitamin B deficiency, candidiasis, or prolonged overclosure of the mouth due to decreased vertical dimension. TMJ examination. TMJ plays a major role in the fabrication of a complete denture. The joint should be examined for a range of movements, pain, muscles of mastication, joint sounds upon opening and closing. Severe pain in TMJ indicates decrease in the vertical dimension. Neuromuscular coordination. The patient is to be observed from the time he/she enters the clinic. The patient's gait, coordination of movements, the ease with which he moves, and his steadiness are important points to be considered. Any deviation from the normal will indicate that the patient is suffering from neuromuscular disease like Parkinson's disease, hemiplegia, cerebral disease, etc. Patients with good neuromuscular coordination can easily learn to manipulate dentures. Thank you for watching my video. Friends, if you like my video, please subscribe my channel and ring the bell icon for latest updates.